Okay. All right, great. Good afternoon, everybody. My name is Peter Zanoni. I'm Corpus Christi City Manager, and this is our joint City of Corpus Christi, Nueces County COVID-19 update for today, which is Monday, May 18. And there'll just be two presenters today, myself and then Annette Rodriguez, our Public Health Director. And I'm going to cover three things. I'm going to go over our statistics since yesterday. We report over the weekend as well, but we'll look to see what happened between yesterday at 4 and today in terms of number of new cases and how those persons that have COVID are recovering. And then I'm going to do an update on a focus this week for the state, and they've recruited our firefighters as testing at nursing homes. So I want to go over that action plan for the community so they'll know in case they have loved ones at the nursing homes or in case somebody at a nursing home is watching today. And then thirdly, the governor had a press conference today at about 2 o'clock, and I'm going to go over some of those measures that he did in his phase 2 opening. And then Annette will come up and talk about that. So that'll conclude my presentation. And then Annette is going to talk about military testing team, some of their results. She'll talk about working with nursing homes to make sure each has a plan to protect the health and safety of the persons there as well as their staff. And then to remind us of some of the high-risk individuals, to remind high-risk individuals, I guess, on safety precautions, how they can stay healthy and safe. Okay, so we'll begin with the status of our cases and other testing information since yesterday. So every day at 4 o'clock, we look back at the past 24 hours. And since yesterday at around this time, we have 8 new cases, 8 new positives. So our number is 242 at this point. You can see the 7-day tracking graph. The testing admittedly was slow over the weekend. We didn't have any drive-through testings, and neither did the military. And so you can see there was just a 2 and a 1 followed by a pretty big week of positive tests. But today we have 8 positives, so we have a total of 242 cases. We still are tracking 3 deaths in Nueces County, and that includes 2 in Corpus Christi and 1 in Robstown. The distribution of male to female in terms of total cases is 58% male and 42% female. Of those 8 new cases, 6 were male and 2 were female. And then the distribution across the age group, we tracked 9 different age groups, and today there was an addition in each of the age groups from 0 to 50, and so we had 3 in the 30 to 39, 2 in the 40 to 49, and then 1 in the 60 to 69, and 1 in the 20 to 29. So it's still looking in those six or so age brackets, the 20 to about 69, there's still a pretty even distribution when you take that total of 242 and kind of divide it by those age groups. Okay, and the number of tests, so we did do a drive-through testing site today. Annette, we did that, right, a drive-through testing? No drive-through testing, but we did do some in-house analysis in our labs. So we did 54 specimens that were tested in our lab, and then the hospitals, clinics, and physicians did 187 tests performed for them. So a total of 241 tests performed today. So our running total since we have been tracking this is 6,738 tests that have been performed for Nueces County. Okay, so let's look at our donut chart here. This shows our total cases broken up into who is recovered, what cases are active, and then the number of deaths. So we like to focus on the recovered rate. This one here, 99. And 99 persons have recovered, which is an increase over the weekend. And that's about 42% of the total caseload. So at one point we were close to, I think, even beyond 50, 54, but with that large number of new cases last week, the unrecovered obviously took a bigger slice of that donut, but today we're at 42% recovered. There was a slight change in the hospital's stay for those persons that had COVID. 1 person left, but another person checked in. So we still have 4 in the hospital, and there's 1 of those 4 persons is in ICU. The others are remaining in general care in the hospital. And then regarding where the 242 persons are, so the majority is in Corpus Christi. Of the 8 new cases today, 7 were from Corpus Christi and 1 was from Robstown. So that gives Corpus Christi about 218. Robstown has 3 now with the addition of that 1 from today. And then let's look at our trending graphs. So a little bit of a change with the dip over the weekend, both in terms of test and then number of confirmed cases. This shows testing on a daily rate in the blue. And then the orange line that kind of goes over is a 7-day average, 7-day running average. So today, the 7-day running average using the past 7 days is 283 tests performed each day. And then when we look at the number of positives or number of new confirmed cases, you may recall the big upswing from last week or so, the little bit of a drop there from the weekend activity and today's activity. So the 7-day running average for number of confirmed cases is 14. So on average, using a 7-day running average, there's 14 cases every day. That's what that graph tells us. Okay, and I believe that's it for the stats. So we'll do a quick translation, Gabby will, and then we'll talk to you about the firefighter testing of our nursing homes and then the governor's orders.
Las cifras más recientes indican que en las últimas 24 horas se han reportado 8 casos confirmados por el coronavirus, haciendo así un total de 242 casos. 140 son hombres, 102 son mujeres. La mayoría se encuentran en el rango de edades entre 40 y 49 años. A la fecha se han llevado a cabo 6,738 pruebas por el virus entre el Distrito de Salud Pública y laboratorios privados. De los 242 casos, 218 son residentes de la ciudad de Corpus Christi. 3 son residentes de Robstown. De los 8 casos nuevos, 7 son residentes de Corpus Christi y 1 es nuevo en la ciudad de Robstown. 99 de los 242 casos se han recuperado por completo. 4 personas continúan en el hospital. 1 está en condición crítica en la unidad de cuidados intensivos. 140 casos aún continúan activos y hasta la fecha se reportan 3 fallecimientos.
Okay, thanks, Gabby. Okay, so if you were watching last week, you may be aware that the governor is doing a statewide testing campaign at all senior facilities. And he's recruited firefighting operations from across the state to help in those efforts through the Department of Emergency Management. So Corpus Christi is joining that effort. And so our firefighters is a group of firefighters that were trained and are going into the various senior facilities, whether it's a nursing home or a long-term stay facility or an assisted living facility. And so what I want to do is just share this with the community so you know, and in case you're there or if you have a loved one at a senior center, at a nursing home. And so some of the statistics, some of the details are that the testing is being done by the firefighter in terms of the swab, but the other partners that are helping the fire department include the city's health department, city county health department, and then Spahn Hospital is helping us actually do the analysis in the laboratory. They're using that new Cepheid machine, so we should be getting the results back within the same day. They can do 1,000 tests in that Cepheid machine that Spahn recently bought. So the firefighters, it's taking about 10 firefighters per event, and then that could vary up or down depending on the size of the nursing home. And not only are the patients or the persons living in the facilities getting tested, but if there's staff involved, the staff are getting tested as well. And so those are the details. The list of the facilities, we have a schedule. I'm going to just kind of read them off here so people know. But today, if today's the 18th, we did Woolridge Place Nursing Center today. Tomorrow will be Alameda Oaks Nursing and Rehab Center. And then the 20th will be Retama Manor. Also on the 20th will be Vista Del Mar. And then the 21st, there's 2 on the 21st, Robstown Nursing and Rehabilitation Center, and the Windsor Nursing and Rehabilitation Center of Corpus Christi. Then on the 22nd, we'll be doing Focus Care at Corpus Christi, Windsor, Cal Allen. There'll be a little bit of break for the holiday, and then on the 26th, Corpus Christi Nursing and Rehab Center. 26th also is Plaza at Mirador, and then the 27th is River Ridge Nursing and Rehabilitation. So that's a complete list of where our staff will be, our fire department, in conjunction with the statewide operation. We have completed, in case you were listening and you may have somebody at one of these other facilities, we have already completed testing at Trinity Towers, Home Green Healthcare Center, Cimarron Place Nursing and Rehabilitation, San Rafael Nursing and Rehabilitation, and the Palms Nursing and Rehabilitation. So those were completed already, and those are some of the tests we're analyzing today. Okay, so that's a pretty aggressive plan, but we know that the nursing homes is a potential outbreak area, and so this will help give peace of mind for our community in terms of if there's any COVID-19 in there or with the employees as well. So let's see, Gabby, did you want to translate that, or do you want me to go into the governor's? Okay, and then I'll do the governor's orders.
El gobernador ha ordenado realizar pruebas en asilos de ancianos. Un grupo de bomberos de la ciudad ha estado ayudando a esa tarea tomando los especímenes, mientras que el Hospital Spawn está llevando a cabo la examinación. Hoy el asilo fue Waldridge Place, pero los siguientes asilos de ancianos son Alameda Oaks, Retama Manor, Vista del Mar, Rosetown Nursing, Windsor, Focus Care, Windsor Galalen, Corpus Christi Nursing and Rehab, Plaza Mirador y River Ridge. Los que ya se han realizado ha sido Trinity Towers, Cimarron, San Rafael y The Palms.
Okay. Okay, great. So at 2 o'clock today, Governor Abbott issued an executive order to initiate what he's deemed as Phase 2 in reopening Texas. He did Phase 1 a couple of weeks ago. Nueces County Judge Barbara Canales has the the county-wide responsibility of adjusting orders that she's put in place to mirror those of the governor. And she's asked that I go over this with the community today. She will be here tomorrow, both her and Mayor McComb coming to these press events on Tuesdays and Thursdays. And she asked that I read this or explain this to the community, and I told her I would this afternoon. But she'll be here as well tomorrow to talk to the community. So she will be, Judge Canales will be issuing an executive order for the county, aligning our guidelines with the governor's orders, right? They have an order in place, and so they'll adjust that at Commissioner's Court. The county's order will be issued tomorrow, and the current order remains in place, and it does include opening those areas that were scheduled to open today, such as gyms and certain offices. The majority of the changes in the governor's orders go into effect on Friday, May 22nd, so this Friday, or after. And so under Phase 2, restaurants may increase their occupancy to 50%. You may recall they can open today, but at 25% occupancy. So as on Friday, they can go up to 50%. And additional services and activities remain closed under Phase 1, may open with restricted occupancy levels and minimum standard health protocols as laid out by the Texas Health Services Department. The governor announced that public schools in Texas have the option to provide in-person summer school so long as they follow social distancing policies and practices, or I should just say social distancing practices, there's no policy per se, and health protocols laid out by the Department of Health Services, the State Department. These classes may begin as soon as June 1st, and no decision has been made for our local schools at this time, but the governor said statewide schools can begin to do some in-person teaching. Via executive order from the governor, this is a list I'm going to go over of the following services and activities that may be open, that can open, not may, but that will or can open if they want under Phase 2. And so for the working families out here, this is an important one. Child care centers can open May 18th. They have been open, but only for essential employees like military, government, those types of employers. So a daycare can open now, regardless of who their client is, on May 18th. Massage and personal care centers, May 18th. Youth clubs can open May 18th. Rodeo and equestrian events, May 22nd on that one. Bowling alleys, bingo halls, simulcast racing, and skating rings, May 22nd. Bars can open May 22nd. Aquariums and natural caverns, May 22nd. That's this Friday, and Tom Schmid from the Texas State Aquarium confirmed that he will open, or his aquarium will open this Friday, May 22nd. Zoos, May 29th. Day youth camps, the governor's going to allow those, any type of youth or summer camp. May 31, they can begin to do that. Overnight youth camps, May 31. Youth sports, May 31. Certain professional sports with in-person spectators, May 31. So we'll be working with Wes, the general manager, or I think that's his title, at the Hooks, because we really love that Hooks stadium and all the players they have there. So May 31 is when they can begin. We don't know if our team's going to do that, but we'll start having conversation with the Hooks. So all sporting and camp activities are required to adhere to special safety standards and minimum standards that have been established for all newly announced open services and activities. Another comment or another part of the order is that businesses located in office buildings may also be open, but they have to limit their occupancy to the greater of 10 employees or 25% of their workforce. And then we covered this already, but restaurants may expand their occupancy to 50% beginning May 22nd. Bars, and this does include wine tasting rooms, craft breweries, and similar businesses, may open at 25% of occupancy, like a restaurant's. These occupancy limits do not apply to indoor area, but they do. Let me see. They do not apply to indoor areas to maintain safe distancing amongst the parties. Okay, so open services and activities under Phase 2 are subject to certain occupancy limits and health safety protocols. Okay, now the last thing that's important is if you want more details and a full listing of all the openings and the relevant dates, the state does have a website. It's a pretty long website, but it's www.gov.texas.gov/OpenTexas, right? So gov.texas.gov/OpenTexas. That's the website. All righty, so that concludes that final part of my presentation this afternoon. Gabby's going to translate that into Spanish, and then we'll have Annette come on up to talk about some of the health district-related issues.
El gobernador del día de hoy anunció la reapertura del estado fase 2. La juez Bárbara Canales me pidió explicar esta información. La juez va a emitir una orden judicial para reflejar las órdenes del gobernador. Los cambios del gobernador entran en vigor este viernes. Entre estos, los restaurantes podrán abrir al 50% de su capacidad. Las escuelas públicas podrán dar clases de verano con ciertas limitaciones desde el 1 de junio. Otros servicios incluyen guarderías infantiles, masajes, clubes juveniles, clubes ecuestres el 22 de mayo, bares el 22 de mayo que podrán abrir a una capacidad del 25%, los acuarios y las cavernas el 22 de mayo, incluyendo el acuario estatal, los zoológicos el día 29, los campamentos juveniles el día 31. Todas las actividades deportivas deberán seguir las reglas de salud. Estaremos trabajando con la administración de los Hooks. Para todos los detalles de los establecimientos y las nuevas órdenes del gobernador, puede acudir a la dirección www.gov.texas.gov/OpenTexas.
Thank you. Annette Rodriguez, Health Department Director. If you are sick and have symptoms of COVID-19, please call the military testing teams. Those are sometimes referred to as the National Guard at 512-883-2400 to make an appointment to get tested. Please be advised that all negative results from them will be given to you by the military testing team, not by the health district. The health district will only notify you if your results are positive because all positives by law are required to be submitted to the health district. So negatives, if you're looking for a negative, it's coming from the military testing team. If it's a positive, we will be calling you with those results. Public health is committed to protecting the entire community, especially our vulnerable population. Older adults and people of any age who have serious underlying medical conditions such as heart disease, high blood pressure, and diabetes are at higher risk for severe illness due to COVID-19. The Health District has been working with nursing homes since prior to the pandemic to ensure that each facility had a plan to protect the health of each resident and staff. We continue to appeal to those who are at higher risk to stay at home as much as possible. And if you do go out in public, make sure to wear a mask and practice social distancing. For members of a family with older adults, please separate your loved ones from anyone who is ill in the household. Disinfect frequently and practice good hand washing often. Finally, to protect the health of the entire community, even if you are mildly ill, do not go to work. Do not go out until you are completely recovered. These actions will help to slow the spread of COVID-19. The City-County Health District is committed to saving as many lives as possible in our community. Again, stay safe, stay healthy, and always stay informed. Thank you.
En resumen, si está enfermo y tiene algún síntoma del COVID-19, llame al equipo de pruebas militares, referido como la Guardia Nacional, al número 512-883-2400 para hacer una cita para hacerse la prueba. Tenga en cuenta que todos los resultados negativos de estas pruebas se los entregará el MTT, no el Distrito de Salud. El Distrito de Salud solo le notificará si sus resultados son positivos. Los adultos mayores y las personas de cualquier edad que tienen una afección médica subyacente grave, como enfermedad cardíaca, presión arterial alta y diabetes, tienen un mayor riesgo de enfermedad grave por el COVID-19. El Distrito de Salud ha estado trabajando con los asilos de ancianos desde antes de la pandemia para garantizar que cada instalación tuviera un plan para proteger la salud de cada residente y personal. Continuamos exhortando a quienes corren un mayor riesgo de quedarse en casa tanto como sea posible. Y si sale en público, use un cubrebocas y practique el distanciamiento social. Para los miembros de una familia con adultos mayores, separe a sus seres queridos de cualquier persona que esté enferma en el hogar. Desinfecte con frecuencia y practique un buen lavado de manos. Si se encuentra enfermo, se le pide no ir a trabajar.
Okay, thank you. I just want to make one point of clarification when it comes to the firefighters assisting at nursing homes. So there's 3 different types of facilities: a nursing home, an assisted living facility, and then a long-term care facility. And all we're doing, and all the state is actually doing, is nursing homes only, right? So and I hope I didn't mislead anyone. So the only thing we're testing is our nursing homes. So there may be a facility where somebody has a loved one, or there may be an employee there, but if it's not a nursing home, then it's not on the state's list of a location to be tested. It could be an assisted living facility or a long-term care facility. So we're only testing nursing homes. That list that I read off are all the nursing homes in Corpus Christi, and it does include the ones that we've completed already. 4 have been completed, either directly through this initiative with the fire department or independently. The health district had completed 1 or 2 earlier before the state got involved. Okay, so that concludes our briefing today. We're here to answer any questions that the media might have.
Hello. Are there any more nursing home / STX beef positive cases? Do we know?
So the 8 that we got today, we don't know the results yet because they all came in from a private lab, and so we won't know until tomorrow.
Okay.
Yeah.
Do we know the status of the firefighters that were in quarantine for taking a man to a nursing home last week?
I don't have the status of them, but as far as I know, they're still in quarantine. Yeah, they're still in quarantine.
Okay.
We have firefighters, police officers, and then some detention center staff.
And that my next question was how the
Yeah.
CCPD officer.
Yeah, the CCPD officers and the detention center staff, they were apprehending and detaining a person that was known to have COVID, and so they're a 14-day quarantine period for sure. And the firefighters will have to check on. I don't know if that person. Yeah. Okay, we'll check on the firefighters to see
Okay.
if that patient they transported had COVID or not.
Awesome. Thank you.
Yeah.
Are we still testing STX beef employee household members?
Are we still testing XTX beef household members?
We already conducted the last drive-through with as many STX, but they're still welcome to go to National Guard.
Yeah, okay. We completed our last drive-through there at the plant, working with the National Guard at the STX plant. The National Guard is doing off-site locations though, and I believe, was there one today? Yes, in Kingsville, there's one today. Was there one tomorrow or? Okay, so Port Aransas tomorrow, Ingleside, and that to say that an STX-B family member can go to either of those free of charge, and so they're still open to the testing through the National Guard, just going to those locations.
Mm-hmm. And do we know of those who've been tested who were like because of their work, like tested because of their workplace that showed no symptoms but actually had the virus? Do we have data on that yet?
For the STX-B plant? Or
well, just I guess any place where you were tested because of their workplace, but in regards to STX-B.
Yeah, do you know, Annette, if there's any, it's about asymptomatic type cases, right?
We actually do, which is kind of interesting. So the nursing homes, those that have come back with some positive employees or residents, they have all been asymptomatic to point. So as of today, which is very interesting to us, but we continue to learn more about this virus every day. STX also had employees that were asymptomatic as well as symptomatic, but they have both. And so we're looking at all of them. They still have to be quarantined, and so all of those protocols still have to be followed. They do not have to be quarantined as long as symptomatic. Those are 14 days. Asymptomatic are 10 days.
And do we happen to have like a number when you say that there are people in nursing home, like the nursing home cases? Do you happen to have a number of how many?
So one nursing home that I know of has like, I want to say 3 residents. And so they've notified the residents, that they're asymptomatic, and 1 staff member. Another nursing home had 2 residents, and they were both asymptomatic as well, and they notified those residents. So those are the numbers right now. We had 1 nursing home with 0 cases of residents or staff.
Okay. And I guess while you're up here, Annette, can we have maybe a clarification of the probable cause category when that's categorized?
Sure. So the probable cause is one that's new. It just started as of last Monday, and it basically says that if you have an antibody test, so if you have antibodies that are positive, and they could be IgG or IgM, and the physician says that clinically you're diagnosed as COVID-19, you have signs and symptoms, then you could be a probable case. But you can also be a probable case if you don't have an antibody test, but you have an link, an epidemiological link, which is either that you've been in contact with somebody with COVID-19 or that you have some travel related. So those are the real 2 distinctions for a probable case.
Thank you so much.
You're welcome.
Okay, do we have any other questions from the media?
Real quick question.
Okay.
As the results come back from the nursing home tests, if there are positives discovered in nursing homes, what's the next step? What's the process for those facilities?
Yeah, let's have Annette answer that one.
So that's a great question. So as the results come back from the nursing homes, what is the process? The process is as soon as we receive a positive case, we let the nursing home know so they can notify the residents' family members, or if it's a staff person, so they can take them out and quarantine them for the 14 days that's required. So that's the first goal, is to make sure the positives, that they know who the positives are. The second goal is to get everybody else notified so they know that if they're negative or positive. Thank you.
All right, any other questions for today? Okay, well, that concludes our press briefing. We want to thank the media outlets that are here, so KIII and Chris Six and the College Times, thank you for covering. And thank you for those watching on YouTube and Facebook and the city's channel, or I'm sorry, we have Telemundo. No, sorry, Univision back there, sorry. And so thank you all for covering, and we'll be back tomorrow at 5 o'clock. It'll be myself and Annette, and County Judge Barbara Canales will be here, as well as Mayor Joe McComb. So we'll see you tomorrow. Thank you.